One of the things that we believe for us to exit this COVID situation, we have to be able to get an effective vaccine. We have been in talks with a number of facilities that to be able to acquire a vaccine when it becomes available. Many of you who have been following the news would know that this morning CNN had some news items where they were talking about Sputnik 5. This is the Russian vaccine that they have been working on. They have completed the phase 1 and phase 2 trial, and I think now they're in phase 3 trial. We have had discussions with the Russian government through the embassy here, and they have expressed a desire that if Guyana so wishes, that we will be able to get some of these vaccines. And as of next Thursday, a part of the Ministry of Health technical team would be engaged with the Russian government in a teleconference to learn more about this particular vaccine. From the reviews that we have seen in the Lancet, this vaccine seems to be safe, but however, we will have to await the phase 3 trials and then see how this would pan out. But nevertheless, we are very pleased to be able to work with them, and hopefully once the trials are over, that Guyana can be a beneficiary. In addition to that particular vaccine, we have been talking to Gavi, that's the Global Vaccine Alliance, and we have been talking to PAHO WHO to ensure that we can also get vaccines through that mechanism. There's a global alliance called COVAX, and Guyana is part of that facility. On the 31st of August, I have signed a letter of intent that the government of Guyana would like to be part of this COVAX facility. Right now, COVAX, they have 15 vaccines that they're looking at, and how the mechanism is working is that whichever of these vaccines have successfully completed the phase 3 trial, the facility would then provide resources so that we can go to the next stage of manufacturing the vaccine. Through this mechanism, Guyana would be able to, as soon as one of the vaccines have been tested and is proven to be effective, through this mechanism, we would get vaccines equivalent to 20% of our population, so that we will be able to immunize at least 20% of our population. We are hopeful that through this mechanism, that perhaps by mid of next year, if everything goes well with the design and so forth of these vaccines, that we should be able to get some of the vaccines through the COVAX mechanism. In addition to this mechanism, and we've had on Thursday last, I would have had an engagement with the Director General of PAHO and other ministers of health in the Caribbean. We had a virtual meeting where COVAX and the way how we can access this particular mechanism and the vaccines, this was the topic of the discussion. And I think we all left that meeting with great optimism. In addition to this mechanism, we have been talking to the government of India, and they too, through the Serum Institute, have also proceeded to make, or they're looking at developing a particular vaccine, and they're hoping to produce 1 billion doses, some of which would be made available to countries across the globe. And we have spoken to them, and we are very optimistic with the talks that we have had so far, that once those vaccines, again, prove to be safe and it has good efficacy, that Guyana would also be able to benefit from these vaccines. There are other hemispheric initiatives, and that is the Argentinian government also are looking at a vaccine to produce 250 million doses. And again, we have indicated to them that we would like to have bilateral meetings to engage with them pertaining to get some of those dosage. And as well, we have had some initial talks with the government of Mexico pertaining to their vaccine development and whether or not we will be able to get some of the vaccines from them as well. So in terms of trying to make sure that we get a vaccine when it's available, we have been actively engaged in various discussions. So once an effective vaccine is available, we believe that we'll be able to procure it and get it for the people of this country.